my name is Susan Senzaki. I'm a pediatric clinical instructor here at Fresno State. I'm going to show you a pediatric head-to-toe assessment on a newborn infant. Before you start, we always begin by checking the name band to make sure that we have the right patient. And before we do hands-on, we also like to do some hand hygiene. It's important to check the room to see if there's any isolation and then to gown appropriately. The best approach when checking your infant or any child is when they're sleeping, it's best to start with listening first. Because when they awake, sometimes they'll cry. And so the best time to do the listening portion of the auscultation is when they're asleep or when they're calm. It's always best to do skin to stethoscope because you will get artifact. And so let's start first by looking at your infant, and let's go ahead and begin. First thing we're going to do is we're going to go ahead and assess the lung sounds, and we do it side to side or bilaterally. So right here we're going to start on the right upper lateral, and then we do left. And if you look at the pattern of how I place my stethoscope, you're going to see that I'm doing this side to side, because sometimes what will happen is you will hear wheezing in one side but not the other. Or you might have decreased breath sounds in one side but not the other. And that decreased breath sounds could be fluid or just inflammation. So we always want to compare laterally, side to side. After you check the first 6 spots in the front, you listen to the heart. We listen to the heart for 1 minute. And the reason why we listen for 1 minute is, first of all, we're getting the heart rate. And the other thing, too, is that we're listening to see if it's a regular rhythm. This is also a time to notice the characteristic of the heart sound, if there's murmurs, if there's clicking sounds. So listening for a full minute. As you're listening for the full minute, this is your time too to notice the breathing and to take the respiration rate. Once you find the heart rate of a child, and with infants, children, and school-age children, it'll vary. When they're infants, it's usually faster from 120 to 160. When they're children, it's usually 60 to 90. And as they get older, then it's usually 60 to 80 is the ranges. So know your ranges. It's very important. After we've listened to the heart for 1 minute, we're going to go ahead and listen to the stomach. As you're looking at the stomach, you want to look to see if they're breathing. And you also want to take a look at the color. And then again, we went side to side. So starting on one side, and then going across, going below, and then going across. And as you're listening for bowel sounds, what it is bowel sounds can be either hyper, hypo, or normo. Normal active will be a few gurgles in that kind of like 15-second span that you listen to each quad. Hypoactive is if you're listening for a full minute, you don't hear any bowel sounds. And hyperactive is if you hear a lot of gurgling within that 1 minute assessment. As we're going down here, we work our way down, and I always like to do head to toe, but now I've done the listening portion. If they're awake, you can flip them over, or if they're calm and you've heard something, you want to make sure that you have not missed anything. If you notice on a child's back, we're going to reassess the lungs in the back, and this is posteriorly, because you're going to notice it's louder. So the lung sounds are much louder in the back because you have more organs in the front than you do in the back. Again, you start at one side, and on this part you listen to 8 spaces. So 1, 2, 3, 4, 5, 6, and then it's important because sometimes you'll hear crackles. When you hear crackles, that's fluid. And if you don't hear lung sounds, then that means it's decreased. And so you go laterally. As you're here, you want to check the characteristic of the skin. You want to look at the spine. You want to check for dimpling or tufting, as that could be a sign of spina bifida. And then also, you want to make sure that there is no breakdown, especially if a child is lying down for long periods of time. Okay, going from head to toe now. And by this time, your child might be awake, but if they're still sleeping, then you continue on. So this right here is the anterior fontanelle. You're actually going to feel a little soft spot, and you would feel right here. Usually this remains open anywhere from 6 to 12 months. Posterior actually closes sooner, and that can close anywhere between the time of 4 to 9 months. And so right here you'll feel a soft spot or sometimes a little divot. Fontanelles are very important in infants because it tells the status of hydration. Also, if there was a head injury, you'll notice some swelling there too. Going head to toe, we're going to look at eyes. I would be checking pupil dilation. What you want to do is when they are awake, you shine the light. You look at the actual pupil, see the size of it, see how it dilates to, and if you want to see that it's equal on the other side. Look at the nose, make sure that they're not nasal flaring, there's no increase of work of breathing. Look at the mouth, make sure that it's nice and patent. And then you also want to check hydration as another way by pinching their skin. And if it tense, then that usually is dehydration. But in infants, you'll see that their skin, especially in their lips, will start to get chapped. Working your way down, you're going to go bilaterally. You're going to check your pulses. And my trick is I actually like to feel at the same time. Because sometimes one arm will be colder than the other, especially if fluids are running. Or you want to make sure that those pulses are equal. Cap-free fill is different than adults. Adults would do here. But sometimes babies are as small or as young as 22 weeks and they survive. And what you want to do is you want to press. And if it's pink, you count as soon as you press. 1, 1,000, 2, 1,003. Equal bilaterally, 3 seconds and less. That's good cap-free fill. You want to check pulses. Oftentimes it's better to check on the most further away from the heart because that actually is a good indication of circulation. And then as you're going down here, you want to make sure that you're checking IVs. You press it, you look at it. So it's called TLC at Valley Children's, which is you touch it, you look at it, and then you want to feel it. So actually touching it, looking at it, and then you want to feel around it, okay? Going down to the stomach, we've listened. Now we're going to go ahead and we're going to palpate for quads. If there are any signs of pain, especially with infants, they can't say it to you, but then you'll start to see that they grimace, or they might like guard. So that's something that you also want to take a look at. You work your way down. We check our peri area, make sure that there's no breakdown. We want to make sure that everything is normal anatomy. You also want to make sure that they're voiding, because if they're not, then they're dehydrated. And stooling is important too. They should at least stool once a day. Working your way down, you're feeling, you're seeing if there's any edema. You check again, pulses. Then we check cap refill. And the reason why I do it both at the same time is because sometimes you're going to notice that one may be delayed, but you're also checking for edema too. And so when I do it both at the same time, you'll see that if it starts to indent and it's slower, then that's edema. Edema usually is a slower return to where they were before versus babies that are chubby. That'll bounce back right away. So that's very important. Let's see. Final thing. And it's funny because oftentimes we want to do the vitals. But when we do the vitals, this will squeeze their arm really hard. So we do that last. Because if they were sleeping, you can do the full head to toe. You want to take this arrow, place it to the brachial pulse. Okay, press the button if it's dynamic, if it's manual. That will be another skill that your instructor could show to you. Take the temperature and place it underneath. And then also, it's also good to get a good pulse ox. So your vitals should be your temperature, your heart rate, respiration, your blood pressure, and pulse ox. Okay, 98.9, no fever. Babies' blood pressure are lower, 82 over 60, that's normal. Respiration is 52, a little bit higher but not bad, but the lungs sounded clear. And pulse ox is 99. Anything greater than 92 and room air is considered well. So that's my head-to-toe assessment, and I hope you've learned something.
Wow.
Is that?
We can already use this one.
Every